Does spironolactone damage kidneys? Is it okay to take spironolactone for 6 months or for 1 year?
Thank you for your question. You're asking if spironolactone can damage your kidneys and is it safe to take for 6 months to a year? Well, certainly you submitted a question that is appropriate for female pattern hair loss and is a common question that is often discussed in our practice with patients with this condition. A little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we've developed to help men and women with androgenetic alopecia using acellular matrix and platelet-rich plasma. And we've been doing this treatment since about 2011. We've developed a system that is essentially been working both with patients who are already on spironolactone as well as with most of our female patients who have never been on spironolactone. So to understand the thinking behind the use of spironolactone, when I see patients who come to me who have female pattern hair loss, and typically a dermatologist has prescribed spironolactone as a way to block testosterone with the working diagnosis that androgenetic alopecia is due to testosterone-sensitive hair follicles, so they suppress the testosterone. Now, it is known that this drug is a diuretic. It works on the kidneys. And I think the question the way this question is most appropriately answered is to discuss the impact of spironolactone on the kidneys with your doctor. It is routine to have lab tests done to check kidney function. But I can tell you that I have patients in my practice who have been on spironolactone for years. In fact, it is also part of many birth control pills to have spironolactone as part of the birth control pill as a way to help, for example, patients with acne. Acne is also associated with an imbalance in testosterone, and testosterone blockade has certainly been shown to help patients with acne. I can tell you from a clinical perspective that when we treat our patients with hair regeneration, and again, to go back to the origins of this treatment, we developed this treatment after using a material called extracellular matrix with platelet-rich plasma to help patients with hair transplants have better healing. In other words, we wanted the donor area to heal better, and we wanted the hair grafts to survive. And so this stem cell-based technology also resulted in thinning hairs becoming thicker. Well, it's been a significant benefit for patients, for women who have come to us from around the world with female pattern hair loss. And until this point, when we've taken on this challenge, there really was not much available for female pattern hair loss. Besides the use of spironolactone, there was also the use of minoxidil. And I can tell you that most of our patients who have tried minoxidil, who are women, did not seem to find much value in it. Now, as far as the effectiveness of spironolactone, I can tell you just anecdotally from the feedback I get from my patients, there's a large percentage of our patients who are on the drug who aren't sure whether or not the drug is helping. And there is a certain percentage of patients who say that they did see an improvement being on the spironolactone. Since I don't prescribe spironolactone and I leave it up to their dermatologist to decide whether or not to continue the drug, I don't interfere with that process. What we do is we do our treatment of hair regeneration, which is an injection treatment that has consistently resulted in regrowth of hair, thickening of thinning hair, and prolongation of the hair growth cycle. And with data that it's now going on beyond 7 years, it has had a very high rate of success, essentially more about 99% or more for female pattern hair loss. And this is actually interesting because it was a challenge, as it was for both men and female pattern hair loss, to develop an algorithm and a system of dosing and placement so that we would get good results. And with women, we had many challenges in the early years. And ultimately, it's become quite a really gratifying benefit to our patients to be able to help treat a condition which, unfortunately, there's no other medical intervention for, in contrast to men who have the option of taking finasteride. So I would say that there is an opportunity for you to have this discussion about your concern about kidneys with your doctor, about the dosing. In fact, because of this, the drug is a diuretic. A lot of our patients would mention that they had to get up at night frequently to go to the bathroom because they were on a diuretic, while others have felt that they can tolerate the drug without any problem. It is a discussion to have with your doctor. It's in the context of your general medical profile. And of course, with the use of routine lab tests to see kidney function, you can also monitor that effect. It's important to also, in my opinion, to also explore other options for the treatment of female pattern hair loss. As I said, we've made a big impact with hair regeneration, and with a long history of experience, I can tell you that it's in our practice, it's so very straightforward, with the exception of some diagnostic unknowns where patients come with a presentation of female pattern hair loss and may have other conditions where we still have to do biopsies and look at other possible causes. But for androgenetic alopecia, hair regeneration has worked out very well and has been a sustainable approach without the use of other drugs. Doesn't mean that there isn't value, because I also explained to our female pattern hair loss patients that women are particularly sensitive to hormones, hormone balance, whether testosterone, estrogen, progesterone, as well as thyroid, as well as other important variables in the blood, such as iron level, vitamin D. And further, the women are also appear to be very sensitive to stress-induced hair shedding, which is a distinction from genetic pattern hair loss. So I always say that it's important to have a team approach when it comes to managing hair loss. That means being followed by a medical doctor, OBGYN, in terms of hormone levels and optimizing hormone therapy if appropriate, endocrinologist, dermatologist. And from our end, we can stimulate hair growth with hair regeneration, and we have a certain understanding as to the predictability based on a patient's profile. And so, essentially, spironolactone may have a value in your situation depending on your doctor's opinion on the impact of testosterone on your hair loss. So I hope that was helpful. I wish you the best of luck. Thank you for your question.